Mr. Speaker, I rise today to share with you stories of real people from Colorado who shared their stories with me and asked that I share those stories with the House of Representatives to help convince my colleagues of the urgent need for health care reform. One woman from Colorado who asked that her name not be used shared with me that she's a physician, she's a provider, she is professionally active as a doctor. Several years ago, she left her hospital-based job and she entered private practice. She herself was able to afford COBRA insurance payments for the allowed 8 months. Her insurance had been through United Healthcare, but she had ovarian cancer in 2001 before she was covered through United Healthcare. And she's been considered, fortunately, to have been in remission since September of 2001. When her COBRA expired this year, United Healthcare's company, which sells individual medical insurance, Golden Rule, accepted her, but with a rider stating they would not cover any cancer treatment of any variety. So although she can provide care to hundreds of people who come to see her as a doctor, she herself has no insurance for the very medical condition that she's likely to need it for. She shared with me that a public option is absolutely critical for health care reform, and she hopes that eventually we'll have a universal system that covers everybody. How embarrassing as a nation, the greatest nation on earth, that a doctor, a care provider, somebody who helps the sick, heals the sick, herself doesn't have access to health care insurance. She's excluded from the very condition that she needs health care for. One of the things that this bill, this health care reform effort accomplishes is we ban pricing discrimination and exclusions based on pre-existing conditions. Anybody who's had cervical cancer can't be discriminated against because of that and won't have that condition or any cancer excluded. It's for individuals like this and millions of others across the country that we need to act now to pass comprehensive health care reform. Thank you, Mr. Speaker.